Good morning. My name is Jenna Davidson, and this is my presentation on disaster prevention. Disasters are naturally unplanned and often traumatic for more than just the victims involved. Many people overlook the fact that even eyewitnesses, first responders, and even the survivors experience the trauma related to the incidents. And mental health providers play a very critical role by providing psychological first aid. Psychological first aid was actually developed by the United States Veteran Affairs Department, or the VA. Psychological first aid is very complex and detail oriented because trauma looks different for everybody, and so will treatment. The great news is that anyone can use PFA, it just needs to be done properly. So typically, mental health professionals are trained to understand that the key principles are making sure that people feel seen, heard, and understood following their trauma. It's also important to note that even family and friends play a really significant role in PFA, as people that you're closest to are going to see those warning signs first. The main role of the mental health professional in these situations is just ensuring the people that what they're feeling is normal, that it's okay, that they're reacting the way that they are, and that this is also temporary. It's also important that the mental health professional sets up a support system if there isn't already one in place. This doesn't have to just be friends and family, it could be a church system, it could be a band of neighbors. It's also really important that we talk about the characteristics of the mental health professional when they're providing PFA. I'm sure you've heard a lot that empathy is the number one go to for providing any kind of aid. Empathy fuels connection when you're talking with someone else and you tell them, hey, I've been here, I know what this feels like. Here's what I did, or here's what I didn't do, and this is what worked for me. And also, you're not alone. Another key principle is self awareness, even though that sounds silly, but you need to be taking care of yourself if you're going to take care of other people. Having proper self awareness can also look like remaining unbiased, even though this is something that we've learned through the code of ethics that we need to maintain. There are several actions a mental health provider can perform in disaster interventions, but the three key responses are look, listen, and link. Look can be described as ensuring constant and ongoing safety for your client while simultaneously providing physical and emotional comfort. The term listen can be described as providing empathy and understanding, like we just talked about previously. And link refers to lining up the primary support persons, including the family members, friends, or community helping, and the resources. I'm sure you're thinking, how does this apply to me? What's the importance here? It's because disasters happen anywhere, and it could happen to you, and it's best to be prepared for in case that it does. Currently in the United States, PTSD is affecting 12 million adults. It's also important to know that your family and your personal loved ones could really be affected. Okay, now we're going to talk about some effective interventions while you're providing PFA. Out of the many effective interventions for post-disaster trauma patients, trusting exercises may be the most important one to begin with. Individuals with any sort of trauma really struggle opening up with people in the first place, let alone a stranger in a business building. Another great intervention is patient involvement, just getting your patients involved in their treatment plan. Make sure that they can see what you're writing, you're going to summarize what you're doing, showing them your computer screen, just involving them in the entire process so they don't feel like they're just another number on your chart. Celebrating success, even if it's small, tiny, obtainable little goals, that's what builds your patient's confidence and makes them wanting to come back. It's like they crave the achievement. So they're going to keep coming back for more, and they're going to keep rocking your treatment program. Okay, now let's talk about ineffective interventions. The first one is going to be over medicating. It's really common for people with maybe crippling anxiety and depression just to be given prescriptions that numb those sensations and numb the symptoms. But when we're dealing with trauma, we don't want the patient to numb those feelings and sensations. We'd rather treat the source because it's not going to go away, especially if it's a very specific incident. We want to help them move forward and past those feelings when they think of the incident and remember all of the stimuli involved. And similarly, trauma-focused cognitive behavioral therapy is seriously what's commonly used for trauma and moving past those sensations and stimuli, but it's not always the best option, just like how exposure therapy isn't the best option for phobias. All right, to sum up today, we talked about a lot, but disasters happen anywhere and they happen to anyone. And it's not just the victims who are affected. And it's really important to keep that in mind. And psychological first aid, or PFA, can be used by anybody, friends, family, loved ones, neighbors. And when it's used by a mental health professional, there's just a few things you got to keep in mind, like looking, listen, and linking, and using that empathy and self awareness. Thanks so much for listening. I hope you have a great day.